Hi, my name is Patsy, and today I'm going to be talking about funding and resources as a barrier to child welfare. When we talk about barriers in child welfare and family support systems, one of the biggest and most consistent challenges is funding and consistent access to resources. And this is not just a policy issue on paper, it shows up in very real and personal ways in families' everyday lives. It shapes the choices they have and make, the support they're able to receive, and everything in between. And even though policies might emphasize prevention, early intervention, and keeping families together, the reality is that many communities do not have the funding to fully support these goals. Services like mental health counseling, parenting education programs, and kinship care are often limited and have long wait lists or are not accessible to a family depending on where they live. This creates a gap between what policies intend to do and what families actually experience in their day-to-day lives. And because of this, families who may already be struggling are left without support until their situation escalates into a crisis, which is not the ideal or acceptable outcome at all. And instead of receiving help early when it could be making a meaningful difference, they may not come into contact with services until their needs have intensified. And at that point, systems like child welfare becomes more likely, and the situation is more complex and harder to stabilize. And it's at the worst case scenario. And this delay is significant. The longer stress builds without consistent support, the more likely families are to experience instability, conflict, and emotional strain. And over time, this can lead to deeper challenges that affect both the parents and the children alike. And in many ways, the system ends up responding after harm has already occurred rather than preventing it in the first place. And another important layer to consider is financial hardship on the family side. Even when services do exist, families may not be able to access them. Some barriers like transportation, lack of reliable childcare, inflexible work schedules, and even just the stigma alone around seeking help can limit whether a family is willing to follow through with services or not. So it's not just all about whether a program is available or not, it's whether it's accessible and truly realistic for families to use. And then at the same time, the systems themselves are overwhelmed. Agencies may be underfunded, they're understaffed while still being expected to meet super high caseloads and meet high levels of need. And this creates pressure on social workers who carry these high caseloads that make it difficult to provide the level of care that they're trained and expected to give. And when caseloads are too high, it becomes challenging to offer individualized trauma-informed care or to build strong, trusting relationships with families. And social workers may want to spend more time understanding each family's situation and providing consistent guidance, but the structure of the system just simply does not allow for that. And then as a result of this, families may receive shorter term care. They aren't getting anything more than surface level interventions. They're not getting the ongoing consistent support that is often needed to create these long lasting stable households. And while these services they can still be helpful, they may not be enough to address the deeper long-term challenges that we find. So programs that are designed to strengthen these families, such as prevention services and family preservation efforts, are also impacted by these funding limitations. These programs, they may only be available for a limited time or to a limited number of families, and when support ends too soon, families may find themselves facing the same challenges all over again, but without the continued guidance. And this can contribute to repeated involvement with the child welfare system, and it's really important to recognize that it's often not because families are unwilling to change or do not care, but it's because they weren't given the consistent long-term support that they needed to truly stabilize their situation. And this brings to attention issues of equity. Communities with fewer resources are most affected by these gaps, which means that support is not distributed equally. Families who are already facing economic hardship are more likely to be encountering additional barriers when trying to access help. So, from a social work perspective, this shifts the focus away from blaming the individual families and toward understanding the broader systems and structures that influence outcomes. It really highlights the importance of looking at the bigger picture and recognizing how policy, funding, and access all play a role simultaneously. Um, Along with this, from a social work perspective, we really need to emphasize the role of advocacy. Social workers are not only supporting individuals and families, but we're also identifying where systems are falling short and punishing for improvements. This can also include increased funding, supporting policies that prioritize prevention, and helping families navigate the resources that are available. But at the same time, even with limited systems, the way social workers still show up still matters. Building trust and practicing empathy and providing as much consistency as possible, even with the workload, really has a meaningful impact on the family's experiences. And at the end of the day, funding and resources are not just administrative concerns, but they directly affect the quality of care that families receive, the level of stress they experience, and the likelihood of deeper involvement with systems like child welfare. The goal is to improve outcomes for families, and if this is the fact, this is an area that cannot be overlooked. Stronger and more equitable investment in services and communities is essential for creating a system that focuses on prevention, creates long-term stability, and truly, genuinely meets families where they are.